In the first 2 weeks after surgery, you want to limit your movement to essential functions. You can get up to eat meals, use the bathroom, etc., but otherwise, you need to be resting your new joint. When resting, make sure your leg is elevated so that it is higher than your heart. This will keep fluid from settling in your lower leg. You can use either an ACE bandage or another type of compression wrap if elevation isn't working well enough. For a total hip surgery, compression shorts can be helpful with swelling as well. You should also be applying ice to your incision site to help with pain and swelling. Doing this will help you limit the amount of medication you need for pain. Follow your medication instructions that are provided when leaving the hospital. As you recover, you will find you do not need a device to aid you in walking. As soon as you can walk without a limp or pain, you can stop using the device. However, don't be in a hurry to push such devices aside. If you're in pain or limping, you need to use a device to keep the stress off your back or other joints. You may need the device early in the day when you're stiff or later in the day when you're tired through this transition. You should also use a device when walking outside your home, where you might run into different surfaces like stairs, curbs, grass, ice, etc. It's ideal not to fall and injure your new joint during the early healing phase. This is a long-term investment, and using an aid is part of that process. Lastly, make sure you don't overdo your exercises and activity in the first 2 weeks. Your goals are to move around some, but mostly rest, and make sure you can get rid of the swelling as soon as you can. Overdoing it can set you back and make for a longer recovery and increased anxiety and pain. Using common sense is very important in your recovery. Approximately 2 weeks after surgery, you'll have an appointment at the clinic. At this appointment, your surgical team, usually a physician assistant, will check to make sure your incision is properly healing and answer any questions you may have. They will also refill any medications you may need. You will also meet with our physical therapist to discuss exercises and your level of activity. At this first visit, our goals are for you to be able to walk well without a limp, either with or without a device like a walker or crutches. For total knee replacements, it is helpful to have a physical therapist appointment soon after the 2-week visit to start your rehab in a physical therapy office. If you wait too long to schedule this, you may unnecessarily delay the start of rehab. They usually need a couple weeks of lead time to get you scheduled. You will return to the clinic 6 weeks after surgery to see your surgeon. They will review x-rays of your new joint and answer your questions. You will meet again with our physical therapist to make sure you're able to return to normal activities. It is important to increase your activity slowly. After this visit, you will enter the next phase of recovery, from 6 weeks to 6 months, where it is very important to start doing the things you can continue for the rest of your life. Activities like walking, cycling, and water therapy are all great ways to keep yourself strong and will bring you better function and pain relief for years to come. You should avoid activities that include running and jumping, as this can be hard on your new joint. For 6 months to a year, you will continue to have improvements in your pain, stiffness, and balance. Activities can be increased as you feel ready and able. Sports that include running and jumping are not the best for the long-term life of the new joint replacement, but this is a personal choice about your priorities. We prefer patients not take up running for exercise, but focus on lower impact activities, such as hiking, biking, and swimming. Try to find substitutes that you can still enjoy without unnecessary wear and tear on the mechanical parts.